it showed that 32.7% of American Indian students use commercial tobacco products compared to 21.8% of the rest of the student population. And so with this alarming rise in e-cigarette use, lots of schools have reached out to the health department for resources. And fortunately, there are a lot of resources out there, various different tools on curriculum, school activities, but also ways that schools can improve policy around this issue, ways that schools can address student use in terms of consequences, but also in terms of tools to help students quit or cope with use. And we had initially pulled together a toolkit in 2018, but have since then revisited the toolkit and updated it. And so today we're going to review the toolkit, some of the big changes, some of the pieces that we're most excited about, and then we'll open it up for some discussion. So like I said, we've made some changes. Some of these changes include new resources and tools. We stripped a lot of old stuff out of the toolkit, but added a bunch of new content. Things are continuously updated and added, and that's something that we're striving to do, is keep making sure that those resources are added to the toolkit as they come out. We also have changed the way that the toolkit is organized. So if you're familiar with the previous version, this new version looks a little different. We've reorganized based on 4 different categories that we'll dive into later, and it's now actually all web-based. So you can go to our website, health.mn.gov/e-cigarettes, and I'll share that URL later. And we've got all our toolkit content posted there, available for everyone to access.
I just put a link in the chat, Parker, so folks can pull up the website and follow along if they want to do things that way.
That's perfect. Thank you, Anna. This new version also better aligns with the WISC model. If you're not familiar with that, it stands for the whole school, whole community, whole child approach. And this is a CDC model that is meant to be student-centered and emphasizes the role of the community in supporting the school, the connections between health and academic achievement and performance, and as well as the importance of evidence-based school policies and practices. So as we've been updating the toolkit, we've been collaborating with the Minnesota Department of Education and other partners to make sure that it better aligns with this model. And that's something we'll also continue to do as we keep updating it. So like I said, we've got the toolkit organized now in 4 distinct sections. The first being implementing curriculum, and we'll go into all of these here in a second, but the first being implementing curriculum. The second section is focused on reviewing and strengthening school policy. The third is helping students, staff, and parents quit commercial tobacco use. And the fourth is engaging and raising awareness about the issue of e-cigarettes, but also the tools and resources that are available to help address it. And so this first section on curriculum is focused on curriculum and classroom activities. You might not be aware, the state of Minnesota recently started requiring that students receive e-cigarette prevention and education. Of course, as sovereign nations, tribes aren't bound by this requirement. Nonetheless, these tools might still be helpful to schools in tribal communities that are struggling to address student e-cigarette use. And so on this side, I put a few screenshots up of lists of resources. This might not be as helpful as actually going to the website with the link Anna gave you and clicking around. Feel free to do that as I talk. But this section offers tools for educators to use in the classroom, including a variety of curriculum options and lesson plans. And so these are broken out by school level. You'll see we've got a section for middle school, and a section for high school. Some of the resources overlap for both of those grade levels, but we've tried to break it out so it's easier for instructors to find what they would use for their students. And it's also important to note that while the tobacco industry, the commercial tobacco industry, continues to engage schools and offer free commercial tobacco prevention curricula, industry-sponsored school programs, from our point of view, are ineffective and may ultimately promote commercial tobacco use among youth. We want to keep that in mind as we're sharing curriculum resources. There's also a section on this page with classroom activities and workshops, including Escape the Vape Video Challenge that's returning in 2022. And Mata, this is what I was referring to before the webinar started. For those of you not familiar, students in middle school or high school can join this contest by creating a short public service announcement video or PSA to educate their peers on the harms of e-cigarette use. And videos, I believe submissions are due at the end of February, but videos will be judged by a mix of youth and adult leaders. Winners could win cash prizes for both the student and the school. And the winning videos will also be featured on not only our website, but we're working closely with media partners here in the state to promote these videos. I think last year they were able to be run on WCCO, their evening news program, as well as PBS, I believe, ran a video or two. But this is just one example activity that is available for students to partake in. And more details about this and the others are up on our website. Resources are also included on traditional or sacred tobacco. We understand the importance of knowing the difference between these types of tobacco and the role commercial tobacco has played in causing death and disease within American Indian communities. And so we've added this section to our recent update for any schools that are able to educate students on the difference between the two. And then the second section, like I said, is focused on reviewing and strengthening school policy. So policies, systems, and environmental changes play a major role in changing the acceptability and social norms around commercial tobacco use, and also reducing secondhand smoke exposure. And commercial tobacco-free spaces are a proven way to protect students and faculty and visitors from secondhand smoke. So commercial tobacco-free schools. This, I'm sorry here. Oh, so state law also prohibits the use of commercial tobacco products in Minnesota schools. However, neither state or federal law covers outdoor areas of school property or off-campus school events. And protections for students may be further limited in tribal communities as they aren't bound by these state laws. So for any schools that are interested in closing gaps in policy, this section has several resources that might be useful, including some model K through 12 school policies that schools could plug and play and adapt to fit their school needs. One of the biggest updates to this section, though, is the addition of our alternatives to suspensions resources. So punitive discipline like suspension, it takes student out of the school, out of the classroom, and it's not really an effective strategy to deter students from using commercial tobacco. And in fact, it might actually be counterproductive. The evidence we've seen shows that students who are suspended are at an increased risk for long-term physical and mental health issues, including increased likelihood to use drugs, including commercial tobacco products. So rather than punishing a student for using commercial tobacco, we're recommending schools provide students with evidence-based programs that support quitting, like My Life, My Quit, which Anna will jump into here in a few moments. And speaking of Anna, I'll pass it right over to her.
Yeah, thanks, Parker. And hi, everyone. Thanks for having us today. I'll jump in here to talk about sections 3 and 4 of the toolkit. So section 3 is about engaging and raising awareness about e-cigarettes. And on this page, you'll find information and ideas for engaging students, staff, faculty, and parents with the information they need to comply with policies and support commercial tobacco prevention work. There's 4 sections on this page with ideas for communicating to these different audiences. And it emphasizes the importance of schools sharing prevention messages, communicating about their policies, and providing information about the free quit support that's available to students, staff, and parents. And they can do this in lots of different ways, which are outlined on this page, like posting flyers and posters, having one-on-one conversations, working with student groups, and holding information sessions. And then the last section, section 4, is about helping students, staff, and parents quit commercial tobacco. I'm going to focus in this section on the youth program, My Life, My Quit, although I'll also touch on the adult programs. My Life, My Quit provides free and confidential help for teens ages 13 to 17 who are trying to quit nicotine, including vaping, smoking, and chewing. It was created with the help of youth and makes it easy to call or text a coach. All of the coaches receive training on traditional versus commercial tobacco and respecting Native cultures and traditions. The teens who sign up for this program receive confidential help through up to 5 coaching sessions and youth-specific support materials. They can enroll as many times as they need. They don't need parental permission, and it's available to any Minnesota teen regardless of insurance status. The My Life, My Quit website also has resources for educators and community organizations. So if you haven't checked that out, it's worth taking a look. And Parker, if you go to the next slide, I wanted to talk a little more about the texting option because that's newer. So teens can enroll in a few different ways. They can go to the website and click that Start My Quit button that you see in purple. They can use that Start Chat button to do an online chat. They can call, or the new option is that they can text the short number 36072. This option is actually open to both teens and young adults. So anyone between the ages of 13 and 24 can text, which is a nice option for people, of course, who are more comfortable texting, but also maybe if you're ambivalent about quitting or signing up and you just want to ask some questions or get more information, texting is a nice way to do that. You can connect with a coach, get some support, and ask questions. On the next slide, you see what the texting process looks like. So you can text anything. In this example, the person texted Start My Quit, and then the quit line will ask the participant about the following: their age to make sure that they're at least 13 years old, their zip code to make sure that they're in Minnesota or another state where My Life, My Quit is offered, and then questions about the type of product and what type of support they're looking for. And once they respond to these questions, they can enroll either in My Life, My Quit, or if they're 18 or older, in one of our adult programs if they're ready to do so. And then they would connect with a coach. And once they're enrolled, teens and young adults can text that number and get connected with a coach anytime. As Parker started to get into, we're encouraging the use of My Life, My Quit as an alternative to suspension when a student violates a school's commercial tobacco-free policies. And we have a lot of research-based information on the website, in the toolkit, on why schools should consider My Life, My Quit as an alternative to suspension. As Parker said, research shows that suspensions are counterproductive and harmful, and My Life, My Quit is a supportive, evidence-based alternative. The coaches are specially trained to engage with teens who have been referred for help by parents, educators, or the justice system and are required to complete a treatment program as an alternative to punishment. All right, I'm also going to touch briefly on our adult programs. So these would be relevant for any students who are 18 or older, and then of course for school staff, faculty, and parents. I think most of you have heard some of this about our adult program, so I'll go kind of quick, but feel free to jump in and ask questions. So Quit Partner is our overall program. It's Minnesota's free way to quit nicotine, including smoking, vaping, and chewing. We offer one-on-one coaching and other tools that are available 24/7. The tools include free quit medications, which are nicotine patches, gum, or lozenges. Folks can sign up online at quitpartnermn.com or via our phone number, 1-800-QUIT-NOW, and interpreters are available. And using coaching and medication together can more than double a person's chances of successfully quitting smoking. We have sort of 2 paths within Quit Partner. Any Minnesota adult can sign up for our individual support tools, which are on the next slide. So this includes 2 weeks of free quit medications and then text and email support. or individuals who are uninsured or underinsured, which is on the next slide, can sign up for the full Quit Partner coaching program, which includes up to 5 coaching calls, up to 4 weeks of quit medications, a welcome package, which is tailored to the individual, and the option to sign up for text and email support. And individuals can enroll 2 times per year. And then under the Quit Partner family programs, we have 3 specialized programs, including the American Indian Quit Line, which I know you're all familiar with. It offers a dedicated team of American Indian coaches and extra coaching calls and quit medications, and has its own website at aiquit.com and phone number 1-833-9AI-QUIT. And this is available regardless of insurance status. And like the general Quit Partner program, individuals can sign up 2 times per year. Our pregnancy program from Quit Partner is another one of our specialized programs. During the Quit Partner enrollment process, folks can sign up for this if they're eligible. And it includes extra coaching, extra quit medications, and can actually carry a person through from when they're planning to be pregnant all the way through postpartum. And then if you move forward, Parker, our behavioral health program is for individuals living with a substance use disorder or a mental illness like anxiety, depression, schizophrenia, ADHD, PTSD, or bipolar disorder. And again, during the Quit Partner enrollment process, eligible individuals are offered to enroll in this program, which also includes extra coaching and quit medications. So I was kind of I would hope a refresher on our different programs and a little more information perhaps on My Life, My Quit, our youth program. We have some discussion questions here because we're curious how you all have worked with schools, if you have. But maybe before we move into that discussion section, we can take any questions on the toolkit or the quit programs or anything else we've covered.
Hello, can you hear me?
Yeah.
We are working with our pharmacist in White Earth on cessation and advertising the quit line and everything like that. And, you know, the different resources for quitting. And he was saying that, what is it? Is it Chantix that's been recalled or something like that? You know about that?
I've heard a little about that, but I don't know a lot about it, in part because we don't provide Chantix through our quit programs.
Okay. Oh, I was wondering if you just knew anything about that, if that was medication of a person's choice to do that. If you just had any insight about how long it's going to be on recall or anything like that.
Yeah, I heard that there was a recall, but I don't know much more than that, unfortunately.
Okay, very good. Thank you.
Any other questions? All right, let's move into this discussion. We're curious to do some information sharing and also for us to learn how any schoolwork that you've done has gone. We're curious, have any of you worked with schools on traditional tobacco education or commercial tobacco prevention and cessation? And if so, how has it gone? What's worked well and what challenges have you faced? And just feel free to unmute yourself or type in the chat box.
Hop in here. Sorry, I just took a bite of food. I was eating in between something else I was doing. But I'm Sam Martin and the Tribal Ship and Tobacco Coordinator for Fond du Lac. And this was a few years ago, very pre-COVID times. We haven't really got to do a lot during COVID, but we did, we had one of our community members who also worked in our public health department do tobacco, our traditional tobacco teachings to the kids, both in school and at our juvenile center. And it was really well received versus us coming in, and it was just a good entryway to talk about like the differences between commercial and traditional tobacco. So we did hands-on harvesting of red willow with the kids. And then we always saved everything that we harvested for community members that were in need of traditional tobacco. Unfortunately, like I said, we haven't got to do that since COVID, but it was a good hands-on activity that the kids really enjoyed versus us just coming in and like spewing facts at them. They seem really less receptive to, you know, like 1 in 8 kids have this, or so that was just something we had done in the past.
Yeah, that's a really cool, tangible activity. And I'm curious, how did you get started with that? I know sometimes schools, it can be a challenge. I mean, of course, during COVID, but even before COVID, because their curriculum are sometimes so full. So I'm wondering just how you got started with that.
So we have, it kind of started, we had an elder that used to work in our department that had good connections with the community and the schools that kind of got the ball rolling, and that Reclaiming Sacred Tobacco documentary was shown quite a bit. And so we'd use that in addition to the hands-on teaching, but then it just kind of evolved. Internally in Carleton County, we have a youth group, Students Offering Support, that it's a youth-led group at every school in Carleton County, and our Native youth are spread out throughout the county at our Ojibwe school and then also like county schools. So they had just wanted, they had invited us into every classroom in the county to do that activity. And then from there just kind of took off. We had connections with our social services department as well, who had a staff at our juvenile center. So it just seemed like it kind of traveled by word of mouth, and then people would request it.
That's awesome. I hope you're able to start that up again in the not too distant future.
Fingers crossed.
And I don't know if you saw it, Gina posted in the chat about kids being hesitant when it comes to asking for help. Is there anything you can say about My Life, My Quit and hesitancy among teens?
Yeah, a couple of things about My Life, My Quit. One, of course, that they can connect directly, so they don't need to get permission or even tell. I know it can be really hard for kids to tell their parents or other trusted adults what's going on. So it's nice that they can just go directly to My Life, My Quit to get the help that they need, and it's confidential. My Life, My Quit does not offer cessation medication because it's not FDA approved for those under the age of 18, which we realize is a barrier. So something we're looking into. But right now, if kids are interested in or needing cessation medication, they can work with their local healthcare clinic or their physician if they have one. I think there's also opportunity to do more peer education on the cessation side. So if students are willing to share their successes, if they've used Quit Partner or other quit support programs, I think that could go a long way in encouraging their peers to try something similar. That's, I think, an opportunity for growth. Anyone else who's worked with schools and wants to share on their experiences, or who have ideas on how they might be able to approach schools to start building relationships? And I see there's a question about enrollment. I guess it's all relative. We do have a regular stream of youth who are calling and enrolling or texting and enrolling in My Life, My Quit. It's something we've been building on since we launched it in April 2020. And we'll have a full evaluation report of all of our quit programs, including My Life, My Quit, later this year, which will be exciting to see. It'll have more information on enrollments and quit rates and that kind of thing.
I can share a little bit of what we've done in the past. I know we worked with Lower Sioux and we did some training with their Indian education program. And so they brought in parents and students together. I think they hold like a regular meeting for them, but had us come in as kind of an outside person to present on, I believe that one was more around e-cigarettes and youth and students in schools, but also, talked about that traditional tobacco lens as well. So I think, Indian education programs are also a good place to start if those are in your school.
Yeah, Chris, to kind of jump off that one too, I remember we did one similarly with Shakopee as well. But I think also too, utilizing other like programs like the after school programs, like I think about all the different tribes that have like boys and girls clubs and things like that, I think would be a neat approach.
Yeah, that's a great idea. And I think you could think about it in sort of two different ways. One is doing this sort of education in those groups, or even engaging them sort of on that next level of helping do things like peer education or programming, developing programming, so that there's more youth-led work.
And many of those classroom activities could probably serve as after-school program activities too. Again, those are listed on our implement curriculum page of the toolkit.
So for example, with that Escape the Vape contest we have going on right now that Parker talked about earlier, that could be a neat activity to bring to an after-school program or student group to provide a little education on what it is and why it's happening, and then encouraging students to create videos and enter them into the competition. And there are cash prizes, which is a nice incentive. Any other questions or success stories, ideas that folks want to share? All right, well, don't hesitate to contact us after this, Parker or me directly. Our emails are just our first name dot our last name at state.mn.us, or you can always email our general emails, or of course through Sarah and Lorraine. We hope the toolkit is helpful for you and your partners in local schools. And like Parker said, we're always updating it. So if there are other resources you think that should be included in it, please send those to us and we can add those in future updates.
Thank you, Anna Parker, for presenting to us today. We will have this recording sent out, or have it posted to Basecamp, I believe, by the end of this week. And yeah, we really appreciate it. And please look forward to be on the lookout for an invite for another TA Thursday with Public Health Law Center.
Thanks so much for having us today. It was good to see everyone.
Yeah, thank you very much.
Yep. I hope you all have a great day.
You too. Bye.